traumatic brain injury or TBI is a leading cause of death and disability in the United States and around the world. There is evidence in the research that traumatic brain injuries can lead to thyroid dysfunction. I am going to answer the question, can brain injuries affect thyroid health? Traumatic brain injuries is frequently associated with thyroid dysfunction, and it goes on to say that in clinical studies, central hypothyroidism, so low thyroid hormones due to hypothalamic and pituitary dysfunction, has been found in some individuals after brain injury. Traumatic brain injury makes sense because it could damage the hypothalamus and/or pituitary gland, and they in turn communicate with the thyroid gland as well as the adrenals. What was interesting is that it showed that thyroid hormone itself is essential for normal brain development and may also promote recovery and neuronal regeneration after brain injury. Whether or not traumatic brain injury can be a factor in the development of Graves' or Hashimoto's, there are multiple journal articles showing that it can lead to an autoimmune process. Just something to think about. Hey, this is Dr. Eric, and in this Q&A episode, I am going to answer the question, can brain injuries affect thyroid health? So in a previous podcast episode, I interviewed Dr. Shane Steadman, who is a brain expert. And during our discussion, he mentioned how trauma to the brain can lead to an autoimmune condition. And so I dove into the research, and there are multiple studies showing this. So one journal article, and the title is The Role of Autoimmunity After Traumatic Brain Injury. I'll try to remember to include this link in the show notes, which you can check out by visiting savemythyroid.com. So according to this journal article, it mentioned that traumatic brain injury or TBI is a leading cause of death and disability in the United States and around the world. And the primary injury to the brain destroys or damages the neuronal and glial cells and compromises the tissues and the blood-brain barrier integrity. And then the secondary injury is a prolonged phase causing cellular, molecular, and functional deficits. And traumatic brain injury evokes systemic and local inflammatory responses. And it goes on to say that immune cells migrate to the brain and gain access to the brain parenchyma due to blood-brain barrier breakdown. And the damaged or destroyed cells displace proteins, or their metabolites are recognized by the immune cells as autoantigens. And the autoantibodies generated may be useful as biomarkers of disease severity. And the autoimmunity thus developed has a long-lasting effect on the body and can be directed to the brain, causing neurodegenerative disorders or illicit systemic autoimmune disorders. Now, so it didn't mention specifically autoimmune thyroid conditions such as Graves' disease or Hashimoto's thyroiditis, and there's no evidence in the research that I was able to find that showing that brain injuries can lead to an autoimmune thyroid condition. It can potentially lead to thyroid dysfunction directly, which I'll mention shortly. But whether or not traumatic brain injury can be a factor in the development of Graves' or Hashimoto's, again, I'm not sure, but there are multiple journal articles showing that it can lead to like an autoimmune process. Again, this one was kind of suggesting that it could be like autoimmunity related to the brain. Like, again, it wouldn't be a surprise if like multiple sclerosis, like if there was a relationship between brain injuries and MS, for example. But as far as I know, I'm not sure if there is any connection between brain injuries and Graves' or Hashimoto's. But there is evidence in the research that traumatic brain injuries can lead to thyroid dysfunction. And so this journal article, which again, I'll include the link in the show notes, shows that TBI, so again, traumatic brain injuries is frequently associated with thyroid dysfunction. And it goes on to say that in clinical studies, central hypothyroidism, so low thyroid hormones due to hypothalamic and pituitary dysfunction, has been found in some individuals after brain injury. And this makes sense because the pituitary gland communicates with the thyroid gland, and then the hypothalamus communicates with the pituitary gland. So you might have heard me or others talk about the HPT axis, the hypothalamic-Pituitary-Thyroid axis, and there's also the HPA axis, hypothalamic-Pituitary-Adrenal axis. So again, traumatic brain injury makes sense because it could damage the hypothalamus and/or pituitary gland, and they in turn communicate with the thyroid gland as well as the adrenals. So I didn't do research showing whether TBIs can cause adrenal dysfunction, but it wouldn't be surprising for the same reason that it could potentially affect the thyroid. But also what was interesting is that it showed that thyroid hormone itself is essential for normal brain development and may also promote recovery and neuronal regeneration after brain injury. So this is important because if someone has a brain injury and they have low thyroid hormones, let's say that they have Hashimoto's and maybe their hormone levels are within the lab range, but kind of on the lower side, so like subclinical, and they're not taking any thyroid hormone replacements. So that could affect the recovery and the neuronal regeneration after a traumatic brain injury. So again, just something to think about. If you are looking to do everything you can to save your thyroid, in addition to watching my videos on YouTube, you also might want to subscribe to my free online newsletter, which is called Healthy Gut, Healthy Thyroid. Not only will you get the latest news on how to heal your gut and restore your thyroid health, but during each edition, I'll demonstrate a different blood or functional medicine test marker that relates to healing your gut and or your thyroid. There will also be an Ask Dr. Eric section where not only can you see questions that other people have asked related to gut and thyroid health, but you can also submit a question for me to answer in a future edition. To subscribe to the Healthy Gut, Healthy Thyroid newsletter, please visit savemythyroid.com/newsletter. Then there's the brain-gut connection, which I'm pretty sure Dr. Shane discussed during our conversation. So the brainstem houses the vagus nerve, and that affects the gut. And remember that you need a healthy gut to have a healthy immune system. So that's another way that, like a brain injury by affecting the gut, and then in turn maybe affecting the immune system. So maybe in that respect, it can indirectly affect thyroid autoimmunity. And then I know we also spoke about leaky gut versus leaky brain. So the bonds, like you have the barrier in the small intestine, and when that barrier is disrupted, that's what's called leaky gut. You got like the Cludin and zonulin bonds, and those same bonds are in the blood-brain barrier. So you could, just like you could have a leaky gut, you could also have a leaky brain. And for those who have a leaky brain, it's not uncommon to also have a leaky gut. And one symptom of a leaky brain is brain fog. Now, you could have brain fog without having a leaky brain, but that is a symptom. And there is a company, Cyrex Labs, you might have heard me talk about in the past. I used to do a lot of leaky gut testing. They're array number 2. They also have an array, which I forget which array it is, but they also have a test where you can use that to determine if you have a leaky brain. As far as I know, the only test out there that I know of that offers that. There might be another company or multiple companies, but Cyrex Labs, I know, is one of, at least the company that I'm familiar with, that does that type of test. So just a few things to consider, but just getting back to the question, can brain injuries affect thyroid health? Without question, it can be a factor. So if you have brain injury in the past, even if it was many years ago, sometimes we might have suffered some type of injury. Maybe it was a sport, or we just banged our head or something, or fell down, and maybe it didn't result in a concussion, but it still might have set the stage for a thyroid condition, and maybe not. Again, not suggesting at all brain injuries leads to thyroid dysfunction. Just again, something to consider. So as usual, I hope you found this Q&A episode to be super valuable. And of course, I look forward to catching you in the next episode.